overall thoughts and impressions as to the utility of assessment in marriage and family therapy practice. Assessment is integral to therapy because it lays a foundation for treatment. Without assessment, therapy is akin to a car trip without a map. A therapist needs to know where all the family members have been, where they're going, where they're now, and where they're going in the future. So some may seek premarital counseling as preparation for an upcoming marriage. A few may need to find ways to deal more effectively with a child who's acting out. Yet others may seek couples therapy to understand why they have become distant from each other after years of marriage. In each of these cases, we use assessment strategies to effectively gather information, develop hypotheses, evaluate treatment progress and outcomes, and facilitate change. And of course, this is an ongoing process, subject to revision based on new information and developments within the life space of the family. Therefore, accurate assessment is important in developing treatment interventions for couples, families, and children. What are 3 examples of how I might apply my knowledge of this course in my future work? While the assessment process is obviously unique to the individual, there are some general principles that apply. Working mostly with children, assessment should involve multiple methods of information, a combination of interviews, observations, standardized measures, and informal assessments serve to strengthen the validity of the assessment. It's important to obtain background information on the child's capacities in different areas of development, as well as assessments of specific areas of functioning of the child's functioning. By using various types of information, I can obtain a more detailed and complete picture and reach more comprehensive conclusions about the child's development. Whenever possible, multiple sources of information are preferred over sole reliance on the identified patient. The identified patient's perspective, usually the child's. Multiple sources can include, but are not limited to, direct observations of the child, interactions between the child and the caregiver and the family system. Additional sources may include data from other professionals, teachers, relevant family members, and other persons who provide social support. In choosing a particular test, I will ascertain the test applicability of the test manuals and materials in measuring a certain trait or construct. Failing to take these facts into account when assessing children with difficulties, I run the risk of violating one of the most basic guidelines for administering assessments, that is, knowing the reliability and validity of and standardization measures of procedures of a measure. Not only that is violating this guideline unethical, but a child who may be assessed using an inappropriate measure may be judged to lack certain abilities. To ensure that the assessment process is being carried out appropriately, there are following questions that I keep in mind. For example, am I communicating with the child and the family in a way that elicit desired results? Do the child and family's results indicate true abilities and their potentials? Is the child exhibiting age-appropriate behaviors and skills for his or her community and peer group? Is the assessment doing an adequate job of highlighting the child's strengths and weaknesses? So keeping in mind these questions, and by viewing the assessment procedure as an active process, I can ensure that I'm evaluating the child and their family with competence and care. And since parents serve as the voice and decision-making authority for the children, in the assessment process, preparing them for their roles as participants is important. Their knowledge about their child makes them the experts, so their input is should be acknowledged. And treating parents as active participants in the process can lead to more beneficial outcomes for the child, for the parent, and for myself as a therapist. Another guiding principle is that individual problems may rarely occur in isolation. So it's crucial to explore the presenting complaint while at the same time challenging the family's certainty that the problem lies exclusively on the child. So broadening the focus from the child to relational patterns is important. Taking note of how family members may perpetuate the presenting problem is imperative. In a related issue, it's essential to view and process assessment data within the client's context. So needless to say, cultural sensitivities is crucial to respond effectively and respectfully to families of different cultures. As a clinician, this translates to interpreting gathered data through a culturally competent lens. An essential step is having the ability to understand cultural differences and possessing some cultural knowledge of the family's culture and worldviews. So, consulting with professionals who are familiar with the culture of the family can provide invaluable information as to the clinical presentation within the cultural context of the family. It is crucial to use assessment strategies that are appropriate to both cultural background and socioeconomic level of the family. While it's imperative to ensure that instruments used have been used within the family's culture and that those tools yield reliable and validated results, it's also important to use measures that capture cultural strengths, because there are families in general, and especially for families of minorities, assessments can be an intimidating and a shame-filled process. So utilizing tools that highlight strengths can ensure that children and families are not improperly diagnosed or assessed because of their racial, ethnic, or cultural factors.